Good afternoon. The topic I chose to discuss today is death, dying, and bereavement and its relationship to social and culturally sensitive care. The end of life represents a therapeutic context that raises social, cultural, religious, and linguistic specificities. Any possible difference offers a considerable potential challenge to both patients and providers. Diverse patients need particular attention paid to navigating beliefs about treatment and issues related to death and dying. Improvements can be made through sensitivity to cultural taboos and scripts about death and dying, as well as the unique nature of every provider patient interaction. Some of the effects of social cultural differences can be seen in patient education and compliance with treatment. Patients and caregivers have varying preferences regarding the disclosure of diagnosis, prognosis, and treatment, as well as the management of decision making in healthcare. Some patients might prefer for a family decision making model to be followed where all family members are present and part of the decision making process, whereas other patients would defer the decision altogether to the provider. Some patients, when discussing death and dying, choose strategies like avoidance. Some patients believe that there's an association with discussing death and giving up, or that if they acknowledge their own mortality, it will hasten the dying process. These can all be hindrances to performing patient education on the topic of death, dying, and bereavement. Another is compliance with treatment. Differences between provider and patient complicate communication of treatment options, as well as the discussion of potentially ceasing life prolonging treatment. It's important for providers to explore the way in which patients understand their illnesses, understand traditional and alternative healing practices, and the values that patients place on those practices, healthcare expectations, and their social context. The provider can use this information to negotiate a mutually acceptable treatment plan that meets the patient's specific cultural or social needs. Improving culturally sensitive care. Cultural competence is the enhancement of skills and abilities to better engage with all cultures. There are two types of cultural competence discussed in the literature and strategies that can be helpful for patient and provider interactions. The first is a pragmatic approach in which culture is addressed and religion specific knowledge is used as a guide to meet patients' needs. There's also the factualist approach, in which the provider shows willingness to expand knowledge about other cultures and religions other than the ones they are most familiar with. Another way to improve culturally sensitive care is through religious literacy. Developing an appropriate language and understanding of the multitudes of faith in society in order to nurture a positive professional practice. This is particularly important at the end of life because of end of life rituals. They serve as an important purpose and they enable people to express their ongoing grief and maintain connections between the dying person, their friends, and family. We as providers have a lot to do to continue to expand our ability to deliver cultural, social, and linguistically sensitive care to our patients. These are the resources I used to prepare this presentation today.